Hi, my name's Greg Fell. I'm Director of Public Health. I'm going to talk a brief bit about what we're going to need to do as individuals and as a city to combat the spread of the virus, because it's clear that potential still exists. That will protect us and it will protect our vulnerable loved ones in the community. So this is going to be a problem that continues for some considerable time. Science isn't going to come to the rescue, certainly in the immediate future. So we will need to reduce opportunities for transmission, isolation, quarantine, infection prevention and control, washing our hands, change this susceptibility via a vaccine, though, as I say, I don't think that will come soon, or reduce the clinical impact should we become infected via effective treatments. And there are one or two glimmers of hope, but they are quite slim glimmers of hope. So I quite often use the three C's, the things where transmission is most likely: crowded gatherings, confined spaces, and close contact. And one or more than one of those C's makes the risk worse. The things we need to do now and in the medium term is actually fairly constant. Distance. We've been pretty good at social distance, or physical distance, I should say. Washing hands, face coverings in enclosed indoor spaces, particularly public spaces. Staying at home if you have symptoms, even if mild, is the thing that makes most difference. And we know lots don't, and I'll come back onto that. Isolating if you're advised to by the NHS Test and Trace or the local public health team, that makes a difference. A lot of talk is given to the 1 meters versus 2 meters. It's a really, really difficult space. The science is pretty mixed. The chief medical officer was really clear. In his view, it was likely that the 2 meter rule would need to be in place as long as the pandemic lasts. That offers maximum protection. The national advice has changed, so we're now working on a 1 meter plus. So my simple interpretation of that is try to maintain 2 meters, and in lots of circumstances it is possible to do that. Going to 1 meters is okay, but the plus bit really, really matters. So the additional risk of closer than 2 meters can be mitigated with other actions, indoors versus outdoors, face coverings. So all of the things that are in the plus bit, they do really, really matter. And if we all ignore it, then the risk of infection becomes higher. Continue to work at home if possible. I'm at home. I've been at home for as long as I can remember. I can work from home. Lots of people can't, but if you can, do. We will try and widen the take in schools. The negative impact of school closure had a huge and inequitable impact. I mean, we want to avoid that. So, in all of this, personal and public responsibility is critical. If we all ignore the recommendations, viral spread will continue, and that will have an impact on us, on our city, and probably on our loved ones. We're all going to need to become mini infection control experts or mini infection control risk assessors. So simple rules of thumb, mine, symptoms. If you have symptoms, stay at home, the end, no matter how mild, because they might be mild to you, and for most of us, we're going to have mild symptoms, but they may not be mild to those that you would pass that infection on to. Distance matters. I've talked about distance. Duration of contact that you have with people, the longer, the more risk. Inside versus outside, ventilation, hand hygiene. The things that make most difference is washing your hands frequently, hot soap and water, or 60% alcohol gel. Face coverings. So could the meeting be virtual? So all up, don't be a contact. Reduce the chance that you will be a contact of someone who has an infection, and it's a really, really important message. And you'll hear me and others talk a lot about that. The reality is that most of us have symptoms are going to be pretty well. Though we see the press coverage of wall to wall people in intensive care, most of us will have pretty mild symptoms. Many of us may have had this illness and just not noticed it. That's great, of course. However, and there's 2 or 3 important howevers, the overall mortality rate is 1%, and 8% of us that have this illness are hospitalised. They aren't trivial numbers, and they are much, much, much higher in some groups of our population. So whilst you might be well, I might be well, I can still pass that infection on to someone else who really might not be well, and they may lose their life. And I think that's the thing that we're all trying to avoid here. We're trying to avoid unmitigated viral spread, because that takes us back to a place we were in late February, early March. You've seen what this can do, and no one wants to go back there. So we're going to need a continued effort to protect the vulnerable, but also we're going to need a continued effort in protecting the vulnerable to mitigate against viral spread.